78-year-old man with advanced lung cancer with metastasis to the brain is brought to the physician by his daughter, with whom he lives. The daughter reports that her father's condition has been slowly deteriorating over the past 2 months. His seizures have been poorly controlled despite maximal medical therapy. He's had progressive loss of mobility, a decrease in executive function, and worsening pain. The patient has Medicaid insurance. Current medications include high-dose corticosteroids and immediate-release opioid analgesics. The need for increased assistance has been distressing to the family, and they're concerned about the patient's overall comfort. The daughter asked the physician about her father's eligibility for hospice care. Which of the following responses from the physician about this model of care is most appropriate? Now, this is a behavioral science question. I don't know if I can call this behavioral science. I mean, this is probably in that gray area of random things that they ask you on the exam. But hospice care is something that you definitely should read about, because you need to know specifically about the eligibility for hospice care, and they do ask this on examinations. When it comes to eligibility for hospice care, since you'll have got this right, I'm assuming that you'll know that one of the eligibility criteria is that the life expectancy has to be less than 6 months. That is what is important. This life expectancy less than 6 months has to be validated by two physicians. By two physicians, it has to be validated. The patients, when it comes to hospice care, patients are eligible for something like this on Medicaid. All right, that's why it's there. Patient has Medicaid insurance, so it's covered under Medicaid hospice care. There is something, I think that one of the options, so the option B, your father's current insurance plan does not cover hospice care. That's not true, because Medicaid covers it. Your father would have to be moved from home to a center that specializes in hospice care. Option C. Now, why I've read out option C is because there is an option of home hospice care also, where hospice care can be provided at home. It significantly reduces the healthcare burden and healthcare cost in the system because the patient is receiving care at home, but it does require family members that will be able to provide some areas of hospice care, like related to probably changing diapers and things like that. All right. When you talk about a facility will do all of these things. Home hospice care is more gentle, let's say, on the US healthcare system in the cost of treatment, because a nurse will probably come in the morning and in the evening to give their medications, to probably talk about any of the concerns that the family has. But the family does provide, someone in the family will be providing most of the physical part of the actual hospice care, helping the patient to move around, cleaning for the patient, bathing the patient, feeding the patient, things like that. But a nurse will be there, will come every day and basically clear your care, your concerns. There'll be also other types of professionals that visit, like physical rehab, and then pain specialists and things like that. But hospice care can be provided at home. So option C is out, because there's no rule saying that they have to be moved. In fact, if they don't need to be moved to a hospice, to a facility, they would prefer that. I mean, the healthcare system, a doctor should prefer that. They should prefer a patient to be cared for at home, rather than to be moved to a facility to be cared for. Your father cannot enter hospice care if there is a definitive cure for the disease. Now, when it comes to curing and things like that, there's nothing like that. A person can definitely, if a person has a medical condition and they have a life expectancy of less than 6 months, and there is a cure for this disease, but the patient refuses the cure, then they are eligible for hospice care, because they're not being willing, they're not taking, or they're not accepting the cure for the disease. If they are accepting the cure for the disease, if they are accepting a cure for the disease, then hospice care is not allowed. So hospice care is specifically palliative care if the patient is currently undergoing treatment with the intent of cure, or with a medication, or with a regimen that is aiming or targeting to cure the disease. Then hospice care, you're not eligible for hospice care. So that's why option D is out. Option E is correct, because this is one of the eligibility rules. And your father's current medication is incompatible with hospital risk of respiratory depression. This does not make sense. Opioids at home there's no rule saying that because the patient's on opioids they can go into respiratory depression and so they can't have hospice care. There's no rule like that. That's why option E is clear cut the right answer. Clear cut.
Thanks for watching. Please give a thumbs up and subscribe for more.